It is News Talk ZB with Chris. So extraordinary news that came out of the WHO. The WHO has warned that the worst is ahead of us when it comes to this coronavirus pandemic, saying that this could get worse before it gets better, which I thought was quite interesting, given the fact that many countries are beginning to ease restrictive measures. So to discuss this, I'm joined by Professor David Murdoch. David, good morning and thanks so much for your time this morning.
Good morning.
So what do you make of this? We've got a situation here where the WHO is warning that the situation can get worse rather than better. What's your analysis on those statements?
Yes, it was interesting, wasn't it? And I'm not sure we actually had a great explanation, although I'm sure it's probably multifaceted. I think there's, at a time when a lot of countries are thinking about de-escalation, I think this was a little bit of a warning just to keep everyone vigilant. I also expect he was worried about the likes of Africa, and I think Africa's been a worry, I guess, the whole way along, just thinking about if the pandemic really took off there, that the consequences could be dire. And at the moment, we're not seeing huge numbers, and whether that's accurate or not, but I think that's probably part of it as well. There are parts of the world we haven't had a lot of coverage. So probably a combination of those.
Okay, so let's look at some potential positive news, Professor. New Zealand's cases are dramatically reducing now. Do you suspect the worst is yet behind us now that our borders are completely closed?
Well, that's our hope, isn't it? I think what we're seeing is the numbers tracking down as well as we really could have expected. So, I mean, that's a real credit to everybody and to the measures. So, that's key. But now is the time really just to maintain that vigilance, and the concern is as we, planning to move to alert level 3, that we could drop our guard a bit. And I think, this is the time more than ever we need to be vigilant about the distancing, etc., because we really don't want to bounce around and have to come back to a situation of going back to alert level 4. So yes, it is good news. It really is. But, we just have to keep at it.
There is a sense, the country is getting much better. I note that some of the news coverage has slowly wound down somewhat, and some of those media briefings now are not taking place as, I guess, people's appetite for more information on this starts to wane. So who knows, maybe it is a good thing. What I think we do need to explore, Professor, though, there are some concerns about what contactless actually means for small businesses. What's your interpretation, and would you say, if in doubt, don't trade? Because I'm trying to work out myself, as many are, what are the specific rules about what contactless actually means? Because I can see there's interpretation on this.
Yes, and I think there are guidelines coming out which we need to kind of follow and address, and the message about if in doubt don't trade is or at least don't do that activity, and as a general principle is probably the right one as we go forward. But it is there's a bit of common sense among it, that we have to keep in perspective, and ultimately it's trying to avoid those situations that could potentially allow transmission of the virus. So that's what we come back to each time, but obviously there's specific guidance that's coming out from a number of sources, and we need to follow that as much as we can.
I think we need more information because contactless, you've got people who have been emailing me saying, hey Chris, I'm a local cafe, I'm getting back in business. People will be able to drive up to my cafe and I'll be able to take the orders. But then if you're still taking the orders and using the FPOS cards and using FPOS terminals, I wouldn't have thought that's contactless, particularly if they don't have PayWave,
Yes, and we will be, I hope, getting a lot more guidance about this as specific questions come along, and we just have to keep abreast of it. And I think it's perhaps not surprising we're not getting information that covers every question people have, but I think there are a real effort to try and address them as the exceptions always come up, and people have to address their own personal situations.
Yeah, we will get more information. The government has been good at doing that on that COVID-19 website. They really have. Does any data suggest that those who have recovered from COVID-19 can either get it again or the virus is staying in their system longer, more so than what scientists had expected? What's your interpretation or your take on that based on current data this morning?
My overall perspective is that there isn't any cause for concern in terms of clear information about not having immunity or staying in the system longer than anticipated. What we've heard is a few, reports out of South Korea and other countries where some people have had, when they've had repeated testing, they've found that that's remained in the system maybe be able to be detected for a while afterwards, and sometimes negative and then becomes positive again. But we really just the overall picture, and there's a lot of interest in these questions about immunity and about whether you can get it again or whether it maintains the system. There really is no evidence at the moment that there's no immunity or prolonged stay in the system for a long period of time, and that's other viruses, other similar viruses. That would be unusual. We would expect for people for this, once they have the infection, that you do get over it. And that other similar viruses, we have seen that people do have immunity, at least for a period afterwards. So we're obviously keenly interested to know, and as time goes on, we'll get more information on that. But particularly the immunity question is vital as we think about a vaccine, because obviously we want to develop a vaccine that will give long-lasting immunity.
Professor Murdoch, what's your thoughts on this virus eventually becoming a seasonal epidemic if we don't find a vaccine that actually works in, say, 2 years' time? Is it possible that we will just add this to the 4 other seasonal influenzas that sweep the globe on a yearly basis?
Again, a good question. I guess time will tell, but that is certainly one of the possibilities that's talked about. Of course, as compared to the other coronaviruses, this does cause a more severe disease, and whether that will impact on how things go from here. The other coronaviruses cause typically the common cold, and it's part of our background of common colds every year. This COVID's obviously a different disease, but yes, we will have to wait and see, and it may take a few years before we know that too, and just how this goes through the different patterns in different countries, the availability of vaccines, all of that will have an effect. But yes, we're watching for it, watching keenly just to see what will happen.
Professor, you sit on the incredibly important Ministry of Health pandemic panel, if you like. I know that's probably not specifically the right words, but you know what I mean. I'm wondering whether there's daily communication or there's weekly questions about borders, because New Zealand's done incredibly well. We've shut our borders. We can't have this going on forever. In a global context, how far off do you think the country would be, this is in New Zealand, from reopening or perhaps a partial border opening? In your professional analysis, are we talking months, a year?
I think we're at least looking months, and I think it is just so difficult to predict at the moment, because it very much depends on what happens in all the other countries around the world and what options are available to reopen. It's clearly the right thing to do at the moment, obviously, to close the border, because that's where, if we manage to eliminate the virus here, that's where the introductions are going to come from. But the opening up is very much going to depend on what happens elsewhere. Of course, we have not so much control over what happens in other countries, and it's just, getting to it. There's undoubtedly going to be, the opening up won't be to everyone all at once. It will be to select places that have obviously got on top of it most likely. So, at least months, and certainly don't think many people are planning on travelling for the rest of this year anyway.
Yeah, I think that's a very sad reality. Professor, just finally, there has been a lot of news lately about teachers being nervous about going back to work, and I understand their concerns. This is unprecedented. We still don't know how this virus reacts, behaves, whatever the situation is. Really, it's still early days in terms of a global pandemic and the dates that we see today. Do you think teachers should be worried? Do you think it should be up? Well, it is up to them whether they return to work. I know that some will next Tuesday, Wednesday. I know you can't sort of be giving out advice, because we leave that to the Prime Minister at the end of the day at that 1 p.m. conference. But what can you tell us? What are your thoughts on that?
Well, I think it's a measured step back, and yes, I think it's not like it's opening up schools and everyone's coming back at once. So it is still maintaining the distancing, and that's going to be crucial. it applies for any activity. That, how well that gets enforced, and obviously there are legitimate concerns in how well that can be controlled within a school environment with children. And so, no, it's. I don't think anybody underestimates the amount of work involved in trying to maintain that sort of social distancing, but that's going to be key. And the interesting about children, we still don't know a lot about the disease, COVID in children, apart from the fact that it doesn't appear that children get severe disease very often at all, and which is great. But the ability to transmit it, otherwise we don't really know. So just applying all those social distancing and personal hygiene rules is just going to be critical.
And just finally, Professor David Murdoch, as we sit here this morning, I recall we first interviewed you in about mid-March, and we were discussing the potential possibilities of this becoming a pandemic. In fact, it was your good self who said to me, New Zealand is already acting as if this is a pandemic, despite the fact the World Health Organization at that point that you came on did not. Is there anything that has surprised you since our very first interview way back in mid-March when it comes to COVID-19, the way it's behaved, or the sorts? Just finally.
Yes, I think probably the speed. Although, having said that, it was something that we kind of knew could happen. But actually, to be in it and to know that within a few weeks we're in a level 4 lockdown and that the majority of the world were in some form of shutdown. I mean, I think that did surprise everybody. So just the fact of how. But even though we've warned about it, to actually witness it and see how quickly things developed, I think that was probably the biggest surprise. I
think we all were thinking and hoping that New Zealand may be excluded because of its geographical isolation, but not to be. Professor David Murdoch, infectious disease specialist who sits on the Ministry of Health panel looking into COVID-19. As always, you are brilliant, and thank you so much for your insight again this morning. You take care.
No, pleasure, Chris.
All the best to you. It is News Talk ZB. We'll be right back.